Bepirovirsen reduces HBV proteins in Phase 2b trial. GSK is a well-known global biopharma company with a purpose to unite science, technology, and talent to get ahead of disease together. Bepirovirsen is a product of GSK. It is an antisense oligonucleotide that targets all hepatitis B virus messenger RNAs and acts to decrease levels of viral proteins instantly. The investigational agent said, Bepirovirsen appears most effective in reducing hepatitis B viral levels for patients with chronic infection when given at a dose of 300 mg for 24 weeks, according to results of a Phase 2b trial. Around 10% of patients treated with the antisense oligonucleotide bepirovirsen, with or without stable nucleoside or nucleotide analog therapy, achieved the primary study outcomes of hepatitis B surface antigen and HBV DNA loss for 24 weeks after the end of treatment. The team of trials found that a second dosage plan of 200 mg for 12 weeks followed by 150 mg for 12 weeks was successful, with 9% of the patients in that study arm who received NA therapy called nucleotide analog reaching the primary endpoint. The effect was reduced when patients at this dosage did not receive NA therapy. According to Dr. Man Feng Yuan, MD, University of Hong Kong said, the main purpose of the bepirovirsen is designed to target the pre-genomic HBV RNA and all HBV mRNAs, resulting in a decrease in viral proteins. In the multi-center, randomized, investigator-unblinded B-Clear study, patients were randomized 3-to-3, 3-to-1 to one of 4 treatment arms to receive up to 300 mg of bepirovirsen, administered as 2 internal injections weekly for 12 or 24 weeks. Clinical case study. Report 1. In case of lower dose, bepirovirsen dosage regimens. 300 mg bepirovirsen once weekly for 24 weeks for 68 patients. 300 mg bepirovirsen once weekly for 12 weeks. Then 150 mg bepirovirsen once weekly for 12 weeks for 68 patients. 300 mg bepirovirsen once weekly for 12 weeks, then placebo once weekly for 12 weeks for 68 patients. Placebo once weekly, 12 weeks for, then bepirovirsen once weekly for 12 weeks for 23 patients. Study participants received 300 mg loading dose of bepirovirsen on days 4 and 11. Study participants received sample loading dose on days 4 and 11. Results. All participants had long-term HBV infection and were on chronic NA therapy for at least 6 months, with alanine aminotransferase, ALT, levels at most 2 times the upper limit of normal, HBV DNA less than 90 IU per milliliter and hbsag greater than 100 IU per milliliter. 1. Out of them, around 73% of the participants were male and 52% were Asian. 69% were hepatitis B antigen negative and had an hbsag level was greater than 3 log 10 IU per milliliter. 2. All the participants were followed for up to 55 weeks, with a 24-week treatment period and 24-week follow-up period. Clinical case study. Report 2. Higher dose is more effective? The research team presented results on 227 patients with chronic HBV infection and on stable NA therapy, as well as results on those not taking nucleotide analog therapy. More patients achieved the primary endpoint in the higher dosage arms than in the lower dosage arms, and no patients in the placebo arm reached the endpoints. A greater proportion of patients with low versus high baseline hbsag levels achieved the primary outcome, a difference of 16% versus 6% in Arm 1. The primary outcome was achieved in a similar proportion of hbeag negative and positive patients, 10% versus 6% in Arm 1. Side effects. 1. While the treatment was discontinued in 13 patients, and 8 patients had an adverse effect that led to discontinuation. The most common AEs were injection site reactions, pyrexia and increase in ALT. 2. Most patients who receive NA therapy remain positive for hbsag and are at risk for relapse, which can be severe and, although rare, even fatal if therapy is stopped, they noted. Dr. J. Hoofnagel, MD, Digestive Diseases and Nutrition at the National Institute of Diabetes and Digestive and Kidney Diseases told, "These results are very promising, but require long-term assessment of whether they are lasting and result in changes in long-term outcome of this disease." Thus, these changes in virologic markers are surrogate markers for the avoidance of the long-term clinical outcomes of liver cancer and end-stage. So this is all about GSK Bepirovirsen Trial 2B. We will meet in next video with new update shortly. Stay happy, stay healthy. If you are a chronic hepatitis B patient with suffering from any complications, please share your comment in the comment box. We would like to request you, if you like this video, please like and share our videos and subscribe our channel. Thanks for watching Great Wisdom of Health channel.